religious beliefs. Where a study conducted on Lebanese university nurses showed 60% believe mental illness comes from black magic, evil eye, or punishment from God. And these are nurses, so they work in the health field. And many people end up resorting to religious clerks to help them treat that mental illness, such as exorcism, for example. You still hear that in Lebanon that it's happening. And some people resort to that before even trying to see a mental health expert. So this is due to the lack of mental knowledge in Lebanon, because there isn't that much of an awareness. However, it is actually increasing with time. Moving on forward, we know that the stigma is closely related to social disadvantages with individuals. Some of the disadvantages include social isolation, where people usually isolate themselves when they have a mental disorder. Social disapproval, their peers start disapproving of them and hiding it, even their families as well. And there is a diminished marital prospects, as in people with their mental health disorder receive less opportunities in life. Lastly, when people have low levels of knowledge and high levels of mental health stigma, individuals with mental health issues do not end up seeking that treatment. So to show you some statistics, in Lebanon, only 6% of children and adolescents diagnosed with a mental disorder seek professional help. And even if they do seek that help, there is a delay in seeking that help of 6 to 28 years before they seek the necessary treatment. That's how long it takes for someone to decide to take help, to start taking or approaching for help.
So this brings us to our second challenge, the lack of human resources. We talked about almost half the Lebanese population experiencing mental issues in their lifetime. However, there's not enough supply of professionals to meet the demand. In the following slide, we're going to discuss the lack of mental health professionals working in the Middle East as a region. We'll zoom into specific numbers of mental health professionals in Lebanon. And then we're going to talk about the brain drain in Lebanon that further contributes to the lack of human resources in the country. So on to the first point, recent evidence shows a lack of mental health professionals working in the Middle East. This is a region that's plagued with conflict and several mental health crises. However, there's not enough mental health professionals working there. But specifically speaking and relative to Lebanon, there are not enough mental health professionals to meet the demands of the population. So it's estimated that there are around 71 psychiatrists and 193 psychologists in Lebanon, according to the number of professionals registered. This means there's a ratio of around only 1 psychiatrist to every 100,000 people, and around 3 psychologists to every 100,000 people of the population. Obviously, these numbers don't meet the demand of the high prevalence rates. And I just want to put this in perspective. And I want to compare these numbers to those in the US. The US is a leading force in the mental health field. And even though the US has lower prevalence rates at around 18%, there's around 125 mental health workers per 100,000 people of the population. So this brings me to the last point in regards to human resources. There is severe brain drain taking place in Lebanon, which prevents professionals from providing their services in Lebanon. Up to 20% of the mental health professionals receiving training end up immigrating to other countries. Unfortunately and sadly, I am an example of this brain drain, in which I had to leave Lebanon to seek better opportunities and avoid the negative impacts of the conflict in the country. So yeah, on to our last challenge. We're going to talk about cost of care. This is another major barrier to the prevention, to the provision of mental health services. There's several different points that contribute to this problem, and we'll examine the relationship between lack of funding, high poverty levels, and how this relates to the high prices of counseling, which prevents individuals from accessing mental health care. So we've established that there's a demand for mental health services, but there's a lack of funding and limited resources given by the government in Lebanon. As mentioned by the Ministry of Public Health, there's only 5% of the general health budget that goes to mental health, which is not a lot, the least to say. So not only is there a lack of funding, but the limited resources are being misallocated. You'll notice in this table that inpatient services, which have the lowest demand in Lebanon, have the highest amount of funding. We know that 54% of this limited budget is being spent on inpatient care. On the other hand, outpatient services, which is severely strained by a refugee crisis, has the highest demand but lowest funding. I'd also like to mention that in addition to the lack of government funding, the private sector of insurance companies, they don't really cover mental health services for the population. Even though inpatient services are said to have limited coverage, the truth is that these companies often fail to pay and cover them. And when it comes to outpatient services, these are not even covered by insurance. So all that said, most mental health services for the Lebanese population come out of pocket. And this leads to another issue because there's a high percentage of Lebanese people who can't even afford these expenses. So why can't people afford these expenses? One reason is there's high poverty levels in Lebanon. A recent study established that there's around 36% of the Lebanese population that lives in poverty. The poverty line for these individuals was determined as people who make $35 a week. This portion of the population makes $4 a day, and that's, if not less even. So these levels of poverty are expected to increase. As we mentioned earlier, there's protests going on in the country against the government that's going bankrupt. And not to forget, with everything going on in the world and with COVID-19, there can be severe economical implications in an underdeveloped country. So I just mentioned that the income of an individual in poverty is $35 a week. We also know that psychosocial treatment in Lebanon averages at around $50 a session. So if you look at the numbers, it's almost impossible for these individuals to pay for mental health services, with the cost of one session being more of their weekly income. And this means that at least a third of the population that's in poverty, they can't even afford these mental health services. But this limitation is not only for people in poverty. I'd also like to mention that the minimum wage in Lebanon is $450. So when you do the math, it's still not enough for people to prioritize mental health treatment into their budget.
So we discussed the stigma, the lack of human resources, and high cost of care that prevent the Lebanese population from accessing mental health services. That said, innovative interventions are needed in order to overcome these challenges. So what is one of the solutions that Lebanon needs to overcome these challenges? It's, of course, one of them is online therapy. 76% of the Lebanese population has access to internet in a study conducted in 2018. And what's very interesting is 100% of the Syrian refugees have access to 3G internet. Therefore, online therapy is actually a viable solution for the mental health demands in Lebanon. There are several different definitions of online therapy. In this presentation, we are making it inclusive of all online platforms such as email, video conferencing tools, and web-based applications. Online therapy and an effective method of mental health intervention emerges as a possible answer to providing culturally acceptable and increasing accessibility and providing affordable mental health services to the community. Literature on online therapy is conflicting. However, several constant themes emerge from the research. For starters, most studies are conducted on populations suffering from depression and anxiety. Although in these studies, an adapted model of CBT is usually administered for treatment. The results from these studies indicate that online therapy as a therapeutic intervention is actually feasible. For example, a recent meta-analysis of 64 trials support the notion that internet-delivered CBT is an effective and acceptable method of treating people suffering with anxiety and depression. Similar research conducted by Totti suggests that high completion rates, positive response to treatment, and patient satisfaction suggest that online counseling can be an effective alternative for adults seeking mental health care. These results are especially significant to consider given that both depression and anxiety are actually the most prevalent disorders in Lebanon.
So we know that online therapy can be effective with certain populations. Now it's important to consider whether or not these services can overcome the challenges in Lebanon. We just touched on stigma, the lack of human resources, and the cost of care as main challenges to providing mental health services in Lebanon. So now we'll investigate online therapy in relation to these issues. So starting with overcoming mental health stigma, we know from studies that the internet is perceived as a safe space in comparison to the real world. As a result, people feel less shame and anxiety when seeking online help. And mostly this would be due to the sense of anonymity and the physical distance that's present in online platforms. So individuals who are experiencing mental health stigma are more willing to engage in online therapy, regardless of the stigma. We have some great insight from the Ministry of Public Health. They conducted a pilot study about an online helping platform called Step by Step. So Step by Step is a 5-session online intervention. They use behavioral techniques and stress management techniques that are designed to decrease the symptoms of depression. The design of this program was a self-help intervention, but participants had the option to reach out and have guidance from a health worker. So falling in line with what Rami just mentioned, online therapy is effective. And as shown in the results of this pilot study, a lot of the participants noted positive impacts on their well-being and decreased levels of depression and anxiety. But the great news is that the client satisfaction data was positive. After conducting interviews, even one participant noted that she experienced drastic changes in her perception of mental health, and the self-stigma she had towards it was overcome, and she was more willing to engage in therapy. Now, in regards to overcoming the lack of human resources, I was really hoping to find information about the numbers of mental health professionals that work in online platforms worldwide. There wasn't any data on that, but I definitely found some common themes that indicate that these professionals in the mental health field are interested in the platform. We know that Lebanon is a country that's at a geographical advantage in the sense that because online platforms can access mental health professionals that are in Lebanon, it can also access professionals that are in the Middle East region. One example is Shezlong. It's an online mental health platform, and we'll talk about it more in detail later on. But it has over 100 mental health professionals offering their services. And this is especially important because individuals and mental health professionals from the Middle Eastern region, for the most part, they share the same language and they have a general understanding of each other's culture. So I'd also like to mention that online platforms can increase access to mental health professionals outside of Lebanon. So of course, we want people who have multicultural competency when working with the population, but it's good to know that when you're working online, you can source people from the US, from Europe, pretty much all around the world. And following along in that spirit, we talked about brain drain earlier, and one example we can increase human resources through online platforms is making use of those mental health professionals that left the country. And we never know, maybe one day I'll be providing services in Lebanon through the internet.
All right. ICBT has been shown to be effective for a variety of disorders and has also been found to be cost effective when compared to no treatment or traditional cognitive behavioral therapy. It has been proven that a participant saves up to $1,824 when it comes to doing ICBT and compared to CBT. These findings are especially important when we consider the misallocation and lack of governmental funding resources into mental health services in Lebanon. Also, we consider the high poverty levels in Lebanon. Providing affordable mental health services is critical in increasing their accessibility. So what are the benefits of online therapy? Well, it lowers overhead costs on both the counselor and the patient, where the counselor doesn't need to pay for rent and utilities, and the patient can save up when it comes to commuting to the therapist. And by cutting down on these costs, online counselors can provide more affordable services and increase individuals' access to mental health services. So to talk about a few startups that that are existing in the Middle East region, according to Magnet, the leading community and data platform for startups, there are about 5 mental health startups in the Middle East. And in my 5 years of experience with startups, where I go to competition and watch people presenting their startups, there's literally in every single competition I enter, there's someone trying to create an online psychotherapy platform. However, most of them actually don't end up continuing. But we have to take into consideration the world of startups where 9 out of 10 attempts end up failing and only 1 succeeds. So some of these startups that exist in Lebanon, some of them are still alive and some of them did not. One of them is Fira, a Lebanese startup. It was in beta version. They were using CBT in virtual reality. Unfortunately, they suddenly disappeared. The startup discontinued. There's Shazlang, which Malek mentioned. It's an Egyptian online platform. It provides online therapy using licensed professionals. Shazlang has a variety of techniques since every psychologist posts his or own or hers method. And the client can choose the one that fits them best. And Shazlang prices its range between $20 to $100 per session. There's a startups such as Sympathicus are more hands-on. Though it is designed to help both sexes, the 3-year-old Lebanese mobile application has women in focus. It addresses symptoms of mild to moderate depression, and it uses CBT as its main approach. Sympathicus uses a monthly subscription model where you pay once a month for 2 sessions, and there are exercises in the app, and the app also tracks your progress as you use it. So Sympathicus was also able to manage to reduce the cost of online therapy. In addition, there's a newcomer. They're called Ismaili, which is a text-based counseling platform. And they use counselors because to them, it allows them to decrease their prices. And their prices are between $20 a week to $62 a month. And finally, there's TakeStep. It's a platform that helps people with addictions by guiding them through recovery and by connecting them to professionals and other resources on an ongoing basis to prevent them from relapsing. In addition, they recently added the ability to call a psychiatrist within 10 minutes. And they are also priced for $50 a month. So only Shazlang, TakeStep, and Ismaili are now still alive, functioning startups. Of course, we have to do some research into finding out what happened to Sympathicus and Sphera. Why did they close down? The noticeable difference is that Ismaili, TakeStep, and Shazlang, they target a wide variety of audience, while the others targeted a very niche audience. This could have been one of the reasons why they were able to survive. So far, Shazlang has been able to cover 14,000 patients in 45 different countries in 2017. So obviously this number is now much more higher than this. And Ismaili has covered so far 3,340 patients. This is interesting to note that the platforms that used CBT did not work, although ICBT has been proven to be successful. Yet we should take into consideration that it could be not the technique why they didn't continue. It could be because of managerial issues or other funding issues that startups usually face. So as you can see, the prices are much lower when it comes to online therapy in compared to the Lebanese. If you want to go face-to-face, where you pay $50 per session, all these platforms are able.
Trauma, because, you know, like we talked about earlier, it gets you out of thinking about the past and into the present, but it can be so emotional.
Beg your pardon, can you repeat?
Meditations can be emotional. You can start.
I'm sorry, it's kind of hard to hear you.
How about we'll take that again later on in the Q&A. So yes, and what Shazlang and the other startups were, they were able to manage to get it for the price of $20, which is something at least more acceptable for the price range of the Lebanese or the average Lebanese person.
So we've examined the challenges to mental health services and how online therapy can be a viable option to overcome them. Here are some future directions we think that need to be considered to ensure they succeed. We know, starting off on the first point, we know that the current state of modern psychology basically consists of theories that originate with Western values and belief systems. This is reflected in the past online platforms that operate in Lebanon. We believe that these theories, though could be helpful, may not be relevant to the Lebanese population, and we need to integrate interventions that are culturally relevant to the population. Following in that spirit, we know that online platforms can source mental health professionals from all over the world. We think it's important that these mental health professionals are providing services in a culturally competent manner. And then lastly, we believe that online therapy should maintain affordable costs to make sure that the Lebanese population can afford them.
So if we really, in order for us to determine how effective online psychotherapy is in a country such as Lebanon, research on the following topics should be conducted. For example, when it comes to costs, we should find out the cost for the counselors in terms of data costs, utility, and rent saving. Lebanon is actually known to have one of the most expensive internet in the world. So that should be usually taken into consideration if it is really going to be cheaper or not. We should find out the cost from the patient side of view for data costs as well. Research the strength of the internet infrastructure to allow using internet as a medium in specific regions of Lebanon. Cultural research has to be done. Are the Lebanese people willing to start sessions online compared to face-to-face sessions? Do people feel less stigmatized when being introduced to online psychotherapy as an option? And when it comes to therapeutic research, is researching multicultural adaptations for online psychotherapy in the Lebanese context. Since, for example, the two startups that tried to use CBT ended up closing. And this should be actually questioned, is whether CBT is the right model or not to use in Lebanon.
All right, so that brings us to the end of our presentation. Thank you all for joining in. We'll open up to any questions. I know we had someone who was asking a question. Go ahead, let's try to answer your question.
Malek, Jessica in the chat asked, are there any culturally specific mental illnesses that professionals outside of Lebanon should be aware of? And it's a two-part question. The second part says, do you have any ideas or references for what interventions would be culturally relevant?
Well, I would say that mental illnesses is a universal phenomenon. There's nothing specific to Lebanon. We did mention that anxiety and depression were the highest of the prevalence rates in Lebanon. But I will say that PTSD is also becoming very prevalent in a country that has a lot of conflict. So maybe related to it's not necessarily related to our culture, but it's more related to the situation in the country. I would say that PTSD, there are high rates of PTSD in the country. And now, let's see, do you have any ideas for what interventions would be culturally relevant? That's a great question. I'm actually very much interested into looking into this moving on. We talked about stigma and how it relates to religion. And I believe in a country and even a region where religion is very prominent, there has to be, to make it more relevant, there has to be integration of religious principles into these therapeutic models. And I think not only will this make it more accessible to the population, but more relevant, and they'll be more willing to engage. And it could, because you want to provide therapy that resonates with them. And I think this is one way we can provide that to the population. Let's see. Also, I know some cultures have clients who accept professionals to be directed and not to question them while that's because of the culture. Professionals in general. What's the culture to, okay. So is everyone reading this, or should I read it out loud?
I can read it out loud if you want, Malek.
Yeah.
All right, so it says, also, I know some cultures will have clients who expect professionals to be very directive and not to question them, while others treat professionals more as partners. What's the culture towards professionals in general in Lebanon?
Rami, do you wanna answer that?
Yeah, I could take that. Actually, in Lebanon, we're not direct as people towards each other. And the culture doesn't prefer that. So when it comes to professionals, the people usually don't prefer the direct approach. You have to ease up slowly into it until they get convinced about the issue that you're discussing. Usually, that's the case in Lebanon.
Okay.
All right, so there's an...
Yeah.
There's another question from Kiori. It says, what is the licensing regulation for the online counseling in the Middle East? And then I'll read the second part.
Okay. Should I answer that first part first?
Yeah, you can answer that one.
Rami, feel free to chime in, but I just want to mention that online therapy as a platform, though it's been out for a while, there aren't many licensing regulations, or it's not until now that they're coming out with all these ethical codes and things of that sort. So I would imagine, and I'd like to get your feedback, Rami, that there aren't any regulations for online therapy in Lebanon. Not to forget that the Lebanese Psychological Association, it's not until now that they came up with ethical codes that are very vague. And if I'm not mistaken, in regards to the Middle Eastern ethical codes with the Psychological Association, they're very vague about online therapy. It's only mentioned once in the ethical codes, and they don't really do anything but define it as a distance counseling, and they don't really touch up on the ethical behavior that we should adhere to. So I would say that licensing in Lebanon in regards to online counseling isn't really a thing yet, but I'd like to hear from you, Rami.
Yeah, to continue on Malek, actually 2 years ago, the government started admitting the existence of psychologists, where we now have a license that only started 2 years ago. That's it, and that's for a psychologist to get licensed. So imagine how long it's going to take for online therapy licenses to appear. Of course, if you want to build a platform, you can become HIPAA compliant, for example, and that's international if you want to do it in your country. In Lebanon, but luckily, I guess well, it's not lucky, it's not a good thing, but Corona is going to speed up this process as more therapists are going to end up going online, and they're already starting to talk about this. So this will kind of force the government to actually work on these licenses, hopefully. I don't know if they will, but they should, because that's where we are going right now. Everything is going to be online, and they should actually be starting to work on that.
All right, so the second part of her question is, mental health professionals can offer services across countries in the Middle East. I'm curious, how to do a similar project in Japan? Sorry.
So then again, of course, and this is Kiori, if I'm not mistaken. Yes, we in regards to Lebanon, in order to provide services, you have to be a licensed member of the Lebanese Psychological Association. And it's not until now that they started really enforcing this in the country. So before, people who were social workers could provide the same services as psychologists, and now they're having it more regulated. So in regards to how doing this in Japan, I would imagine looking into the rules and regulations over there. I'm not too sure what the scope of it is over there, but especially with online therapy. But yeah, it's something I don't really have the answer to be honest.
I guess I could help, with that. Well, of course, you should first check the rules, like Malek said, in Japan, for example, and you should look into telehealth platforms. For example, Zoom offers a telehealth section where you can purchase this package alone. And this is for online regulation of telehealth services. And this is a telehealth service. So you can use such methods to connect. For example, you connect the patients online via a website, but when they want to conduct the therapy, they have to use a certified telehealth service. And one of them that offers that is actually Zoom, and you can check in their product this part of service. So this is how you can start. And of course, you should use licensed psychotherapists in order to match the patients with them.
Yeah. Thanks, Rami.
Thank you. All right, so Manal is asking, I'm also curious about your resources. Do you find it difficult to gather updated and relevant info with regards to mental health in Lebanon? I know that information is not always easily available or present.
Yeah, sure. I'm looking up at my references now, and it's fairly recent data that we've been able to collect. I've had an interesting conversation the other day with a professor of mine who I was trying to get advising in regards to this topic, and she was mentioning that Lebanon as a country shares this similar problems and challenges as her home country in Guam, which is in South America. And what's interesting about Lebanon is, yes, we are an underdeveloped country. However, due to the refugee crisis, there's the refugee crisis in the region, there's a lot of NGOs providing services in the country. So as a result, and to get support, we've actually been putting out data as much as we can to get support. Now, there's a bunch of resources over here that you can see range from a year ago all the way to 2008. But in regards to mental health, the Ministry of Public Health, the latest official report was 2015. So everything related to mental health and data collected by the government is the latest official results were posted in 2015, which is not too far back in regards to relevant data, I would imagine. Because it did come, 2015 is after the refugee crisis and not too far away from everything that's going on right now. Thanks. All right, are there any other questions? We'd love to answer them. All right, well, I really appreciate you all for coming in. It was great to present to you all. I hope you've taken something about this presentation. We have Kayori who's looking at similar things in Japan, and maybe this gives you more insight into a problem that is universal, that happens everywhere in the world, and we're just trying to shine a light on Lebanon and how we can provide services in that country. So I really do appreciate you all for coming. Thank you so much and have a good rest of your day.